Hello, Miss Maynard.
Hi.
Hi, how are you today?
Good, how are you?
Good. My name is Alana. I'm a nurse practitioner student
Hi.
at South University. What brings you in today?
Checkup.
Okay, good. Do you mind if I ask you a few questions?
Go for it.
Okay. What is your full name?
Sandria Faith Maynard.
Okay, and what is your date of birth?
February 13th, 2005.
Okay. Do you know where we're at today?
The doctor's office.
Absolutely. And do you know who the president is?
Donald Trump.
Okay, great. Thank you.
No problem.
So the patient appears well dressed and groomed. She's alert to 4. Do you mind if I take some vitals on you?
Go for it.
Okay, great. I'm going to start with the blood pressure. So how have you been feeling?
Great.
Good. All right, I'm just going to have you relax your arm right here. All right, blood pressure is 102/58, pulse is 78. Respirations are 18. I'm just going to take your pulse oximetry. This just reads your oxygen. Pulse ox is 99. I'm going to take your temperature. Temperature 98.4. Okay, how tall are you?
5'4".
Okay, and how much do you weigh?
I think 111.
Okay, so 5'4", 111, that puts her BMI at 20.6. I'm just going to take a quick look at you and just kind of look over your skin, all right? Just want to do this because we live in Florida and just want to make sure that nothing's going on. So skin is supple, good skin turgor, color is normal. No bumps, lesions, or markings. No redness noted anywhere. I'm just going to touch your head now and your scalp, okay? All right, scalp is symmetrical and head is symmetrical. No bumps, lumps, or deformities noted. Hair is even distribution and normal texture. Face is symmetrical with no deformities noted. I'm just going to touch your head and you tell me if you're feeling tender anywhere. Any tenderness?
Nope.
All right, no tenderness noted. I'm just going to feel your pulses here. All right. Temporal pulses are +2 bilaterally. Now I'm going to have you squinch your jaw as much as you can, okay? Does this hurt at here? Do you have any problems over here?
No.
The joint? Okay. She has an intact trigeminal nerve, strong masseter muscles. So now I'm going to have you give me a big smile. All right, raise your eyebrows for me. And I'm going to have you squint your eyebrows down now. So cranial nerve 7, facial nerve is intact. So now I'm just gonna touch your face and you tell me if you notice sharpness or dullness. Does that feel the same?
Yeah.
Is it sharp or dull?
Sure.
Okay. Does that feel the same?
Yeah, it's sharp.
Does that feel the same?
Yeah.
Okay, wonderful. So now I'm just going to take a look in your eyes. All right, so you're going to notice a little bit of a bright light. Normally I would dim the lights, but we wouldn't be able to see with the camera, so we're going to do the best we can here, all right? So why don't we first, you know what, I'll tell you what, let's go take a look at the Snellen chart over here. So I'm going to have you step back as far as you can, and I want you to tell me the line, the lowest line that you can read comfortably. And you don't wear glasses, correct?
No.
All right, perfect.
I can see L F F O D P C T.
Okay, not quite. Why don't we take it to the next line up?
D E F P O T E C.
Okay, patient's vision is 20/20, uncorrected. All right, come on, sit over here again for me. All right, so I'm just gonna have you, I'm gonna look at your peripheral vision. So what I'm gonna do, I'm gonna have you cover your right eye for me, for starters. And I'm gonna cover mine, and I want you to just look straight ahead at me and tell me when you see my finger wiggling, okay?
I see it.
All right,
See it.
look at me, look at my nose.
See it. See it.
Okay, now I'm gonna have you cover your opposite eye. All right, ready? Look at me.
See it. See it. See it. See it.
Okay, wonderful. All right, so now I'm just gonna take a look at your eye movements. So I'm just gonna have you follow my finger up and down. And then we're gonna go right, left, and then we're gonna look up like an X. Okay, movements are symmetrical, no extraocular movements noted in all cardinal gaze positions. So now I'm gonna take a look at your pupils. All right, I'm gonna look at both eyes. Pupils are equal, round, reactive to light and accommodation. Pupils are symmetrical. So now let's take a look. I'm going to have you, I'm just going to look in your eyes. I'm going to look at iris, sclera, and conjunctiva are intact. No yellowness to the sclera. Eyes are white with normal vasculature. All right, so now I'm gonna, normally I would, like I said, dim the light, but we can't because we need the video. So I'm gonna just take a look in your eyes, okay? Open real big for me. All right, I see red reflex. Cornea is creamy pink. And we have a normal cup to disc ratio. All right, so now I'm going to, actually let me just take another look in here. Let me get your vessels and really get a good look at that. The vessels of the eye are normal. I see dark lines for arteries, light for veins, and normal distribution. Okay, so now I'm just going to test your hearing and look at your ears. External ears are normal in color. Do you have any tenderness?
Mm-mm.
All right, no tenderness noted bilaterally, no masses, bumps, or lesions. And now I'm just going to take a quick check of your nerves. So I'm going to first whisper in your ear. Can you hear me?
Mm-hmm.
So she can hear the whisper.
Can you hear me in this ear?
Okay, wonderful. So this is kind of a funny test. First I'm going to take this tuning fork and tap it. I'm going to put it on the top of your head, and I want you to tell me if you hear it greater in one side or another or the same. Okay? How does it sound? One side more than the other, or is it the same?
The same.
Okay, perfect. So sound lateralizes to both ears. And now I'm going to put this on your jaw, and I want you to, and then I'm going to move it to your ear. So I want you first, when it's on your jaw, tell me when you stop hearing it. And then I want you to tell me when you stop hearing it when we move it to your ear, okay?
Stopped hearing it.
Okay. Still hear it?
Alright.
Okay. Air conduction is longer than bone conduction, twice as long. I'm going to do it on the other side now, okay? So we're just going to put that to your jaw.
Stopped hearing it. Stopped hearing it.
Okay, air conduction twice as long as bone conduction in the left ear as well. So now I'm just going to take a quick little look in your ear. Be gentle, you see a piercing here. All right. Tympanic membrane is intact. It's pearly gray with no bulging noted. She's got a mild amount of cerumen in her ear canal, but otherwise no obstructions. I can see the malleus umbo and incus, and the white reflex is at 4 o'clock. I'm gonna look into your left ear. All right, again, we have a mild amount of cerumen noted. Tympanic membrane is intact, pearly gray, no bulging. I can see the umbo and incus, and a cone of light is visible at 12 o'clock. Okay, so now I'm just going to take a quick look at your nose while I have my light. The nares are patent, the mucosa is red and moist. The turbinates are visible, no deviation noted. All right, I'm just going to touch your sinuses here. You have any sinus pressure or pain? Okay. Any pain?
Mm-mm.
Any pain there?
Nope.
Okay, good. So now I'm just going to have you, I'm going to get some gloves on because I want to take a look at your mouth a little bit. All right, can you open your mouth for me?
Yes.
Okay, very good. Can you stick out your tongue for me? Can you say ah? Okay. Oral cavity. We have gum margins are well defined. Gums look healthy and pink. Teeth are all intact. Airway looks patent. We have no lesions. Let me see your tongue real quick. No lesions on the floor of the mouth or side of the tongue. Uvula rises symmetrically. That tells us our vagal nerve as well as our glossopharyngeal and hypoglossal nerves are intact. Tongue moves symmetrically and the palate also moves symmetrically. So now I'm just going to check your neck, all right? So I'm going to have you first bend your head to your chest. All right, now bend it back. And now go straight for me. We're going to turn side to side. And now I want you to touch your ear to each shoulder, okay? Any pain, tenderness? Okay. So the neck exhibits full range of motion without any tenderness or pain. So I'm just going to check all your lymph nodes now, okay? And you let me know if there's any pain or tenderness.
Okay.
feel your occipital nodes. So there is no pain or tenderness to any lymph nodes. Lymph nodes are freely movable without any swelling. So now I'm just going to kind of touch your thyroid gland, so it may feel a little strange for a minute. I just need to push it side to side. I'm going to feel it. Now swallow for me. A little more swallow. All right. Thyroid gland is normal size and position. No swelling or enlargement or nodules noted. Any tenderness on that? No tenderness noted. Okay, so now I'm going to just take a look at your shoulders. All right. Shoulders and clavicles are symmetrical in normal position and alignment. Any pain or tenderness? No pain or tenderness, no crepitus noted to palpation. So now I'm just going to move each of your shoulders around. So we're going to take this one, we're going to kind of rotate it. All right, that's good. I'm going to have you bring it across you. We're going to bring it out like that. Up and back. Okay. Right shoulder is freely movable with no crepitus or pain noted. And we'll do the same thing on this side. You just let me know if you are feeling any problems. So we're going to move that around. Have you come up front, come across. We're going to come back that way and bring your arm back behind you. Any pain?
No.
All right, no pain or crepitus noted. Left shoulder moves freely. So now I'm going to have you shrug your shoulders for me. All right, nice strong movement there. So our spinal accessory nerve is intact. She has appropriate resistance. And now I'm just going to touch your elbows. Any tenderness there? All right, elbow joint moves freely, no crepitus. Epitrochlear nerve not palpable, not epitrochlear nerve, epitrochlear node not palpable on the right. We're going to go to the left elbow. Any pain?
No.
All right. Left elbow moves freely, no crepitus. Epitrochlear nodes not palpable. So now I'm just going to have you sit, so I'm going to touch your arteries. So, all right, so the right brachial artery is palpable with +2 pulses. The right radial artery is +2. Left radial artery, +2. Left brachial artery, +2. Okay, so I'm just going to test your strength in your upper arms now. So I'm going to have you put your arms like this. Now push against me. All right, I'm going to have you turn this way, push up, push down, and then I'm going to have you kind of make a fist and push me this way with your left. And now we're going to do the same, right? Good. Strengths are 5 out of 5 to upper extremities. Now we're going to take a look at your neck and chest. So chest rises symmetrically, chest appears normal contour, breathing looks easy and unlabored. The respiratory rate is approximately 18. The anterior posterior diameter appears normal, with the lateral diameter being twice the AP depth. And so now I'm just going to feel your carotid arteries. All right, carotid arteries are +2 bilaterally. And I'm going to take a listen to your arteries now. Normal pulse to the right carotid artery, no bruit noted. You're on pulse to the left carotid artery, no bruit noted. So now I'm going to take a listen to your heart, okay? So I'm taking a listen to her aortic, pulmonic, tricuspid, and mitral valves. All right, we have no audible rubs, murmurs, or clicks. The rate and rhythm is normal. The point of maximum impulse is at the 5th intercostal space at the mid-clavicular line as expected. And there are no visible lifts or audible lifts, heaves, or thrills. So now I'm going to take a listen to your lungs, okay?
Okay.
Deep breaths for me. All right. Bronchovesicular sounds are clear. Vesicular sounds are clear. I'm going to have to move your breaths just slightly. I'm sorry.
Good.
Lungs clear to auscultation at the apexes bilaterally. So clear lungs. So now I'm just going to, we're going to defer the breast examination. Do you do a self-breast examination? I hope you do. So now I'm going to just touch your chest, all right?
Okay.
So I'm going to come around here. Can you say 99 for me?
99.
All right. Can you say E?
E.
Okay. So palpable tactile fremitus. And then I'm just going to tap on your chest, okay? So this is called percussion. So we're going to percuss your chest. So all right. Lungs are resonant percussion with no dullness. Noted. I'm just going to take a listen to you. Take some deep breaths for me. Lungs are clear to auscultation posteriorly. Now I'm going to have you do that E thing again. I'm just going to have a listen, okay? So
All right.
do that E.
E.
Again.
E.
Again.
E.
Again.
E.
No E to A change noted. Lungs are completely clear. All right, so for this part of the exam, I'm going to have you lay down because I'm going to need to check your belly, okay? Oops, sorry. I'll get my clipboard out of there. So let me just take a look, if you don't mind. All right, abdomen is symmetrical with normal contour, no hernias noted, no scars or striations noted. I'm just going to take a quick listen, okay? You've been having normal bowel movements?
Yeah.
All right. Bowel sounds are audible in all 4 quadrants. I'm going to just take a listen to your arteries now, all right? All right, abdominal aorta, renal arteries, iliac arteries, femoral arteries are all audible with no bruits. So now I'm going to do the tap thing again. So I'm just going to tap on your belly a little bit, okay?
Okay.
All right. Abdomen is tympanic in all quadrants with no dullness noted. So now, oops, I'm so sorry. I'm just going to tap on your belly again. I want to try and feel for your liver, okay?
Okay.
So let me get a little pen here. I'm going to mark, actually, for this one. Oh, I have to have you put your hands to the side. I'm sorry.
My bad.
All right, so I'm going to tap you again right up here. So we're about here and here. All right. The liver border is at the costal margin. The upper border is at the 6th intercostal space at approximately 8 centimeters. And now I'm just going to tap over where your spleen is, okay? Can you move your hand for me?
Yeah,
Yes,
my
thank
bad.
you. All right, we have resonance again. So there is no splenic enlargement noted. And now I'm just going to touch, I just want to try and feel your aorta if I can. You can relax a little bit. All right, the abdominal aorta is palpable at approximately 2 centimeters wide. And now this is going to be maybe a little ticklish in this part. I need to just kind of touch your tummy and just make sure we don't have anything going on in there. All right, so we're just going to do some light. Okay, just try and relax. Just take a breath. There you go. Breathe. All right, now I got to go a little deeper, okay? All right, relax, just relax. Any tenderness anywhere?
Nope.
Okay, no tenderness, masses, or organomegaly noted. So now I'm just going to push kind of a little bit hard on your left side, all right? Oh, sorry about that. Any pain on your right side?
No.
Okay, no rebound tenderness noted. So now I'm going to lift up your leg here, okay? So I'm going to take it straight out, and we're going to go straight out and up. Any pain?
Nope.
Okay. So psoas sign is negative, and then I'm going to have you bend your knee. All right, so we're going to go like, any pain? All right, obturator sign is negative. So now I just have to touch your bladder. So I'm sorry, a little bit ticklish again. Have you gone pee recently?
Yes.
Okay, you did. Okay. Any tenderness?
No.
Okay. I'm just going to tap right here again. Bladder's tympanic. It is non-tender and non-distended. So now I'm going to have you sit up for me. And I'm just going to kind of touch your kidneys here. And give me a little tap. Any pain?
No.
Any pain?
Nope.
Okay. No costovertebral angle tenderness noted bilaterally. We're going to defer the rest of the genitourinary examination for now. So now I'm going to have you stand up for me, okay? So let me just look at your hips. Any pain?
No.
All right, hips are symmetrical, no tenderness or edema noted. So now I'm going to have you kind of lay on your back again because I'm just going to, yeah, just on your back because I'm going to just check the range of motion in your hips, okay? So we're going to go up again, out, in, we're going to turn that in, turn that out, okay, and we're going to do the same on this side. Up, down. I'm gonna have you bend your knee. All right. Hips are freely movable. Any tenderness?
No.
No tenderness noted. So now I'm gonna have you sit up for me. And I'm just gonna look at your knees. Have you had any knee trouble or any pain?
No.
Okay. Can you bend your knee for me?
Yeah.
All right, we're gonna rotate it out in, we're gonna rotate it out. And then I'm gonna do what's called the drawer test. So I'm just gonna hold some pressure on your knee here, okay? And we're gonna check your anterior cruciate ligament. Any pain?
No.
Okay, good. So we're gonna check now her left leg. So let me take a look at your knee. Looks symmetrical, no edema noted. I'm gonna have you bend your leg up for me. Okay, we're gonna go this way, out, in, and I'm gonna check that drawer test again. Any pain?
No.
Okay, so the anterior cruciate ligament is intact, no pain or subluxation noted during range of motion. So now let me take a look at your ankles and your feet. Feet are warm, skin color is normal. Ankle joint is freely movable on the right side. Plantar and dorsiflexion are normal. The left leg, ankle is freely movable. Dorsal and plantar flexion are intact. No edema noted to feet or ankles bilaterally. So now I'm just going to have you do some resistance exercises against me. So I want you to push down, push up. All right, good. I want you to turn your foot in and turn them out. Good. Okay. Any pain there?
No.
All right, strengths are 5 out of 5. Now I'm just going to feel your pulses, okay?
Okay.
Femoral arteries are +2 bilaterally and symmetrical. Popliteal arteries are +2 and symmetrical. All right, dorsalis pedis pulses are intact, 2+ and symmetrical. And posterior tibial pulses are 2+ and intact. So now we're going to do that touch test again. I just want to kind of see how your lower extremities are doing. So I'm just going to give you kind of a sharp touch, and I just want to see if they feel the same on both sides. Or you tell me, does it feel sharp, does it feel dull actually?
Okay.
So let's start with this. How does that feel?
Dull.
Okay. Both sides?
Yeah.
Okay. How about now?
Sharp on both sides.
Okay, so you felt that evenly. So sensation of touch is intact bilaterally. Okay, so now I'm going to have you, I'm just going to test your strengths of your legs. So I'm going to have you push up against me. All right, push down, push out, push back. Okay, and we're going to do the same thing. Push up, push down, push out, push back. All right, strengths are 5 out of 5 bilaterally. They are even. And now I'm just going to check your tendon reflexes, okay?
Okay.
All right, so first I'm just going to have you relax your right arm here, all right? And I'm just kind of rested against my arm. All right, biceps reflex is intact. Now I'm just going to have you kind of hang your arm over me. This is a kind of strange one, but just relax your arm, all right? Triceps reflex is intact and brisk at 1+. And then I'm just going to have you kind of relax your wrist. The brachioradialis reflex is intact at 1+. Ooh, patellar reflex is 2+ and brisk. And then just relax your foot. Achilles reflex is 2+ and brisk. Sorry. Patient exhibits is negative for Babinski and has an appropriate plantar response. So now I'm just going to check your reflexes on this side, okay?
Okay.
So again, relax that arm for me.
Sorry.
Oh, okay. Let's try that again. Here, just relax your arm. Okay, biceps tendon is 1+ and brisk. Triceps tendon is 1+ and brisk. Brachioradialis is 2+ and brisk. Patellar reflex is 2+ and brisk. I'm just going to relax your foot again. Achilles reflex is 1+ and brisk. We have a normal plantar response and negative Babinski. Okay, so now I'm going to give you an object to hold. So close your eyes. And I want you to see if you can tell me what it is without me telling you, without you looking.
Pen.
Okay, perfect. Patient is able to identify object by feeling. So now I'm going to have you, I just want to test the coordination on your right and left side. So I want you to rapidly alternate touching your fingers to your thumb like this. Okay, very good. So now we're going to do the same thing on your left side. Rapid alternating movements in upper extremities are normal. Coordination is intact. So now I'm going to have you tap your feet. Just kind of tap both feet. All right, perfect. Coordination in bilateral lower extremities is intact. So now I want you to I'm just going to check your balance and your gait. So I'm going to have you walk heel to toe for me like this.
Okay.
Can you do that for me? Just go across the room there. Excellent. Heel to toe movements are intact. Patient is able to walk normally and has good balance and posture. So now I'm going to have you put your arms out, turn them over, and close your eyes. Recessing for pronator drift. No pronator drift noted after 10 seconds. All right, you can relax. All right, so for the last part of our exam, I'm going to have you stand up. We're going to perform what's called Romberg test, where I check your balance. So I'm going to have you stand there, close your eyes, and cross your arms over your chest. Feet together. All right. Patient's balance is intact. We have a negative Romberg sign. And that concludes our exam for today. You check out very well. Everything appears to be good in good working order. So I thank you for your time.
Thank you.